Inside dressing is done using a moist gauze which is opened up and folded like shown in the picture. A nice tug is given on both sides and you are all set to do the dressing. Take one end, slide it around the fixator pins, preferably around the ones which are most difficult to reach at first, and make sure that you move the gauze in a back and forth motion with very little angulation around the pin site. Imagine four sides to the pin, and I tell all my patients to imagine north, south, east, and west. Remember, each side needs to be cleaned 5 times by means of this to and fro motion. And gradually, a little by little, blood and some amount of body fluid is going to get imbibed onto the gauze, which is completely normal. All the four sides have to be cleaned thoroughly with utmost care without any rigorous movement. Thereafter, fold the gauze onto your fingertip and take it onto the pin site, which you have just cleaned with the to and fro motion, and massage it. While doing so, move the skin a little bit away each time, 5 times from the pin site. Repeat the same process on the other pins, probably which are slightly difficult to get comparatively. Make sure that you get all of the fluid that has been collected from the previous day. Every day, this needs to be done almost 24 hours apart. And this ensures that there is no form of pin site infection to the patient while the fixator has been placed in situ. Thereafter, make sure that you again roll it onto your fingertip and massage. Massaging helps you to get rid of the hard to get debris. Do not scratch, pull, or use any instrument to get any of the clotted blood, especially which is around the pin site. Thereafter, use a fresh gauze, fold it like shown earlier, and wrap it around, enclosing 2 pins or 3 pins. You can slide it around like so, and if required, you can tie a knot. You can also just tuck it all together and slide it down, as shown here.